Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we are going to talk about, this is going to sound like, why are we talking about this? But we're going to talk about why you've gone through our healthcare system and have not been able to find the relief you're looking for. And then one of the questions we get frequently when we're on calls with people from out of state is, can you just send me to someone in my area? Okay, we get the question frequently enough that we wanted to answer it on this podcast. But of course, our mission is to educate and empower. So the education piece is here. Part of this, we don't want to make it like an education discouragement. So we're going to leave with that sense of empowerment to keep driving, pushing forward, finding solutions, okay? On this podcast, I have Dr. Gutwein, our other primary provider here at Novera. Thanks for being on the podcast.
Yeah, of course. It should be a fun topic.
So Dr. Gutwein and I, we were discussing it this morning that it's not uncommon for people to request that we send them to someone in their area. And sometimes we feel that it's a little bit, maybe awkward's the word, or there's maybe a sense of like embarrassment for maybe embarrassment, not necessarily on our end specifically, but of our healthcare system. And because it's a very reasonable question and one that we want to be able to answer with, yes, there is someone in your area, and we look it up and we find their website and then we send you their way. But unfortunately, that hasn't been the case. And so we're going to break that down because we feel like you deserve to understand that better. Sometimes on those calls, we have about 2 minutes to explain why it's not something that we can necessarily fulfill. With the caveat, now we're going to go down this journey of explaining why it's a tough question to answer. But there's a caveat here, okay? So if you go back and you listen to our framework podcast, and the framework's kind of sprinkled in throughout, but the framework is three things. So we look at the actual source of pain itself, and that's primarily our job. We want to restore mobility. We want to treat the thing that's actually causing your head to hurt. The second thing is we want to look at developmental barriers. So one of those big things is sleep. What's your quality of sleep, and can we improve that? And airway. Okay, so that department is not something that we specialize in. And even here in Colorado Springs, we refer out for that, but it's helpful to a lot of people. The third thing is systemically. So what is your overall health? What's your gut health? What's the level of inflammation running through your system that's impacting your body's threshold? Are your hormones balanced? Things like that. That third category in our framework is also something that we refer out to, even here in Colorado Springs. And so those two categories, there's definitely people that you should be able to find in your area. Now, through our health coaching, that's oftentimes if we see a potential need for something like that, a provider like that evaluating you, that's where we'll say, hey, there's someone like this in your area. The other caveat is if we feel like there's a specific segment or type of treatment within physical therapy that you may benefit from, then we can say, hey, go to a clinic near you, get evaluated, and see if they can do whatever it may be, whether it's dry needling or jaw work, something like that, okay? Now, the scenario we're talking about is a scenario where someone contacts us, we have a 30-minute virtual discovery visit or something like that, and the question is, hey, can you send me to someone in my area that can do what you do? And that's the question is someone who thinks like us, who can replicate the techniques, who can take someone in your situation, which most of the time is frequent migraines or debilitating headaches, and be able to intervene in a way that's helpful. And so that's the scenario we're talking about. And I want to make sure that's clear, just so it doesn't sound like we're talking about like, oh yeah, we can't refer out for anything, because we definitely love our partnerships and the other people that come alongside treatment. Okay, so first, Dr. Gutwein, let's just talk about the other types of providers. So think back on PT school and your training, what did we learn as PTs? And then when we understand, like, whether it's medical doctors or other types of providers, let's maybe list the other providers that people might see and why their specialty may not be necessarily addressing the underlying problem.
Yeah. I mean, we were talking about this earlier when we were discussing like this topic, and I think in PT school and just in general, like in the PT profession, there is this idea of, like, in terms of migraines, there are certain avenues, or there's a certain kind of path you take, and if they've run through that path, then and are unsuccessful, then maybe it's at that point it's just a cervicogenic headache, and that's the only one that we can help. At least that's how it was at my school and in various kind of clinics I've worked at. And as I've been on like my journey as a provider, I've just found that that's really not a very helpful model, and it usually means that people are just kind of stuck in this loop of provider searching that can seem never ending. And I don't know. I mean, we even took a course together a few months ago, and the guy who was teaching the class was like, he put up the chart, and I don't remember the specifics of the chart, but it was like, if it's a cervicogenic headache, well, we can help that, and let's push that. But then it said, if it's a migraine, well, and then he said something along the lines of like, well, obviously we just refer out for that. Like, and I think that's kind of the general mindset, is like, top of the food chain is neurology. And that's for good reason. Like, neurologists have to go through so much school. But I would say 9 out of 10 neurologists that I'm aware of, or in general, are probably just like migraine, and then they're going to go through this regimen of medications. Try this medication. If that doesn't work, then go to this medication. If that doesn't work, then you get, the monthly injections and the Botox and all of that. I was talking with, I had a new patient yesterday, and I was just telling her, I was like, that's all symptom management. That's saying you have this symptom, you have these pain receptors that are kind of off the chain. You have these nerves that are kind of angry or flared up, and all that those medications are doing is saying, okay, we find that there's a nerve that's inflamed, so let's block the pain signal. Let's mute the nerve. Let's go on like anti-epilepsy medication or an anti-anxiety or an antidepressant, like these medications that just suppress the system, but they're not figuring out why is this system so heightened in the first place. And I think that that's the big thing, is trying to figure out in terms of everything that's going on, why are the symptoms happening. Now sometimes you need the medication to block the pain because the pain is debilitating, but that should be a temporary thing that eventually points to the ultimate why are these symptoms happening, and figuring that out. And at least in my experience, I'm sure this is similar to you, and why this clinic exists and why this podcast exists is that so many people don't know that why, and they're just kind of out there floating about trying all these different approaches.
Yeah. Excuse me. The most common scenario is, you go to your primary care, then you go to neurology, and it's symptom management. When we think of a provider in our healthcare system that treats the neck, I think most people would think chiropractic, which chiropractic is like if we're gonna potentially, not that we're out to like create enemies or be against something, even medication has its place, but I would say the medication only route and the lack of education in our healthcare system that allows people to feel stuck only taking medication is the thing that we're against. And so chiropractic, although different than what we do, is addressing the neck in a way that can be helpful. The primary difference is looking at alignment. And this is something both imaging in a medical doctor's office and then imaging within the chiropractic office and the chiropractic model. The focus is on alignment in chiropractic, the imaging in the primary care or neurology office is like imaging for the purpose of like screening out something else, something that's physically in your body, applying pressure, causing a headache, something like that. Or potentially they're looking at, changes in the neck, degenerative changes, but they're still images, is my point. And so the chiropractic model is looking at the neck, treating it. There's different types of treatment for when it comes to chiropractic care, but oftentimes it's going to be, what they'll call an adjustment, like a manipulation in physical therapy terms of the spine. And then that adjustment is intended to improve alignment. And so the problem though with that is it's missing sort of the biomechanics of the neck. So how do we function? How do we move? And then specifically how each segment of the neck moves. And so their philosophy would be, you get the alignment right, we move better. As a physical therapist, I mean, going through anatomy, cadaver labs, working on patient after patient, alignment is an element that we want to consider, but ultimately, over time, if these joints haven't been moving, the ligaments surrounding them would have adaptively shortened, and we need to apply a fair amount of pressure to that joint over and over again in order to get it moving again. And so that's our philosophy and our approach in order to address the actual neck. But chiropractic, is definitely closer and something that's not bad or something that should be avoided, but maybe has missed the mark in your situation or provided temporary relief, or maybe didn't do anything at all, because we hear that quite a bit. And so, chiropractic, and then what are maybe some others? I know like acupuncture, massage, potentially like optometry.
Yeah, I know that some people will go and they'll go to a dentist if there's more like a jaw involvement. I think a lot of people do, and I think this is an appropriate idea, but maybe still not getting to the deepest why. But they'll feel that their like autonomic nervous system is off, that they're just stuck in this kind of sympathetic nervous system response, or like fight or flight response. And so they'll do like meditation, or they'll try to do like breath work or yoga, more that's like trying to like calm down the system. But I mean, I know you've kind of had an analogy where you say it's like you're trying to do, when you have migraines, it's like trying to do a complex math problem with 2 fire alarms going off in each ear. And so you can try as hard as possible to get that nervous system calmed down, but then as soon as you're back not consciously thinking about it, your body's going to hear those fire alarms, and it can put you right back. But helpful stuff, helpful to do, helpful to consider. In the long run, it is going to be beneficial, but you still have to figure out what's going on with those alarm bells. Why are they going off in the first place? So I think I think that's the thing as well, is like all of these things can be helpful. I tell a lot of people too with like chiropractic, it's like it can be helpful. But oftentimes it's not fully helpful, and that's why people end up here, is because it addressed a portion of the problem, but then what we're really focusing on is that functional mobility, creating that habit in the neck of the upper cervical segments of the lower cervical spine, into like the thoracic spine, the first rib, into the jaw, and not just getting everything in a straight line. That's part of it, but more so it's getting into that movement. Are your joints moving how they should be moving, where they should be moving, and are the muscles appropriately able to like pull on the right segments and create functional mobility?
Yeah, so the underlying problem is that you need to find a provider. So again, going back to our framework, the first spoke in the framework is finding the underlying source of the pain itself. Now, the pain is likely, or all of your symptoms, not just the pain, but your symptoms are likely generated from dysfunction in the neck, jaw, shoulders. And so finding a provider that looks at that and is able to diagnose it and treat it effectively is a challenge. other types of treatment are not doing nothing and can be helpful and provide valuable insight. But we need to get to the underlying actual source of those symptoms, and then look at the big picture: overall health, airway, sleep, all of those good things, which other providers definitely have value. And then, like you said, even medication can help manage symptoms. Okay, so there's two primary things. The first is misunderstanding the diagnosis itself. So let's talk about that a little bit. And I think what people are asking when they ask us this question is, okay, even if a provider misunderstands the diagnosis, mechanically, like how we treat, can't we just find someone and say, hey, I know you think I have migraine and that's a vascular issue, but like, can't you just treat my neck? And so both are fair questions. Let's talk first about misunderstanding the diagnosis. So yeah, Dr. Gutwein, maybe you can talk to what is assumed to be the underlying cause of migraines in our healthcare system, and then why that's trusted and sort of the problem behind that.
Yeah. One of the things that I find is that migraines, and specific like the different classes of migraines, they are almost just describing symptoms as well. I mean, because I have I have people that come in all the time, and it's kind of like they'll use the terms interchangeably of like, I have headaches and I have migraines, and I know a migraine when I have it because it feels more like a migraine. And I know I have a headache when I have a headache because it feels more just like a headache. And then specifically, people will say I have different types of migraines. I have vestibular migraines, or vertigo, or
atypical migraine.
Yeah, atypical. Like all these just different types of migraines, and then even in the different types of headaches. But really, all of those different types of headaches. I think I think it was the episode last week. Like it just talked about all the different types of headache, but those are almost just describing symptoms. It's like, okay, well, you have visual issues, so we'll call it an ocular migraine. You have like sharp pain, so we'll call it a thunderclap headache. You wake up with a headache, so we'll call it an alarm clock headache. But that's not really, it's not really that helpful. It's just saying these are your symptoms, so that's the type of headache you have. And I do think that's quite a bit of a disservice. It can feel, I do think there can be value. Like it can feel vindicating to know, okay, I don't just have headaches, because I think that can be a common like thing that people with migraines struggle with, is like that perception that people, like most everybody has had some form of a headache. And so when they then tell their coworkers, or they tell their friends, or tell their family, like, hey, I actually can't go to work today, or I can't go to that family event because I have a headache. There's that perception of, well, I have headaches too. Like I've had a headache, and you just push through it, take a Tylenol. But migraines, headaches, whatever you want to call them, no matter your like official diagnosis, like there does come a point where that migraine is now debilitating. It's impacting your life, and you need to find a way to be able to not just describe those symptoms, because while helpful, that's not all encompassing, but figure out like truly what's going on. And I think that next level of understanding is kind of where the medical community falls short. It's almost like the end all be all is like, okay, well, you have migraines, and it's like, well, why? And it's like, well, because you have migraines. You have migraines because you have migraines. It's like, well, that's circular reasoning. That's not really that helpful. So being able to figure out that why. I mean, is that similar to kind of how you've seen this, how patients are coming to you as well?
Yeah, definitely. It's there's a barrier. When you said the top of the food chain is the medical doctor or the neurologist, their understanding impacts how other providers are going to function and treat someone with migraine symptoms. So it's impacted our profession quite a bit, and it's something that we haven't stepped into, which is part of the problem that we'll talk about in the next question. But it's the circular reasoning is medication works, so it's a vascular problem, or it's a it's a serotonin issue or there's a chemical imbalance. And the other thing that's complicated is it's not just pain. It's sensitivities to lights and sounds and nausea and vomiting and visual disturbance and these things that that also make it confusing for providers. And then the dynamic is they're not actually finding anything objective, and they have all this training. And so it almost, for them, not having an answer, but having all the training so that they're the ones that should be able to understand and provide the answer, almost leaves them and then the people that they interact with to believe that there is no answer, right? And so it's just a paradigm shift. It's a paradigm shift of like, oh, like we thought we screened the neck appropriately, but we haven't been. So once we shift that perspective and we start to treat it and it gets better and we do that over and over again, that's essentially our story. And so the diagnosis being trusted as like, hey, there's something behind this is the first problem, okay? And so the second problem is, okay, if a provider... can I just go to a provider, even though they don't understand like what a migraine truly is, to just work on my neck? Let's talk a little bit about, as physical therapists, the training we were brought up in and what we've seen in our profession that sort of gives us a lack of trust in a provider being able to do this sort of thing. Do you have some stories that come to mind?
Yeah. I think the bummer is that the first thing that comes to my mind is that it's not really the therapist's fault. It's kind of the system that our, specifically like the insurances have put the physical therapist in. I was even looking on, just like a social platform earlier today. And one of the posts, it gave like the median range of income for a physical therapist in, I think it was 1983, and then it said, okay, what's the inflation equivalent if it was that income today? And it was about the average of what a salary is for a physical therapist today, which face value is like, okay, great, it's matching expectation of what a physical therapist made in 1983 is about the same of what a physical therapist is making in 2025, but so much has changed in the field of physical therapy since 1983. In 1983 is a bachelor's degree. Somewhere along the way it became a master's degree, and now pretty much everywhere it's a doctorate degree, yet we're making the same as a bachelor's degree, which is kind of like, that's unfortunate. That's unfortunate. But then also, I think what that does is that incentivizes insurances to say, okay, yeah, you're just a bachelor's degree profession. You're not a first stop care. You're not a primary care, like someone has to refer to you because you're just a physical therapist. And so that incentivizes insurances to reimburse low, which then means in order for a physical therapy clinic to be profitable, which, it's kind of necessary to be profitable. You can't run a business if there's no profit. Then you just have to see bulk patients. So many of the clinics I worked at, it was like 3 to 4 patients on the hour. And I've heard of worse. I've heard of, clinics where it's 2 patients every like 15, 20 minutes. And you get the end of the day and you've seen 30 or 40 patients, and then you have to do documentation. It's a very quick recipe for burnout. But then if someone comes in, let's say, one of those 35, 40 patients is a migraine sufferer, you're doing maybe a 10-minute brief, quick evaluation. You say, okay, there's something with the neck. If there's something wrong with the neck, ideally that person needs manual care. But if that therapist is seeing 4 other patients at the time, there's no chance. There's no chance that they can give them adequate manual care. What it's going to be is it's going to be exercises, and then it's going to have to be some sort of modality of like an e-stim machine or ice or heat, and all of that. Like, the sad part is that can be done somewhat effectively at home. And those are just like short-term pain blockers. Those aren't long-term changers. So I don't think that the fault, I can just say physical therapists are bad. Like, no, that's not at all it. Like, it's the system that physical therapists are in. And I think thankfully what I'm seeing is there is a change in the profession of physical therapy where there are more and more like clinics of a similar model to us, of cash-based clinics who are saying, okay, if insurance is telling me that I need to see multiple patients on the hour, then like basically like I fire insurance. Like I'm not working with them because they're not valuing our profession. And so in order for our profession to be valued, I need to see patients for an hour. I mean, that's how long we see a patient for. And I tell that to some of my like peers or people that graduated about the same time as me, and they're like, you get to see a patient for like a whole hour? I'm like, yeah, every single patient I get to see for an hour. That's not just like the one-offs because I had another patient cancel or an eval. It's like that's every patient I see, and that's what people deserve. I think it's the same too of like MDs and neurologists. Like they're so burnt out. So how could we expect them to get to the point where they're doing a thorough objective measures, outcomes, like what's going on, how do we track progress? It's like, no, they've got 15 other patients in the waiting room who are chomping at the bit, who are also in chronic pain. And so, yeah, the medical model has kind of pigeonholed us to be like patient mills. We're just plugging and chugging. And so I think then the next question is then, okay, so what if a patient, what if there is a practice, near me that is cash-based? Like, can I just go see them? If they see me for an hour, is that okay? And while I think that, like, if you're going to see a physical therapist, let that be the type of physical therapist you see, the one who can actually do prolonged care. But then you get into the issue of, like, specialty. Like, migraines are a specialty case. There can't just be like a generic approach or just like these 10 exercises with these 5 stretches will work with every migraine. So if somebody doesn't have the clinical practice expertise of saying, yeah, I work with people with migraines, I wouldn't say that it has to be like, in order to be, the migraine specialist, that's all you have to see, but it should be a huge portion of what you're seeing. And then I've also just found that there's practices, in town or around that do like say, yeah, I work with headaches and migraines, but then they're still coming to us. Like they're coming to us after, like maybe some progress, but it wasn't comprehensive. Like they're still dealing with migraines and headaches. And so, yeah, like I don't want it to sound like I'm tooting our own horn too much, but, yeah, like specializing in physical therapy is not very common. In other professions it is, but for some reason in physical therapy it's not. I think that should be more common, and especially in terms of headaches and migraines. Like you really have to understand what's going on, joint specifically, the nerves, the ligaments, systemic inflammation. And I didn't learn much of that in school. Much of that has been working here, talking with different connections, different providers, talking with patients, and just seeing like all of the circles that patients have been in with different providers, pointing them to this provider who pointed them to this provider, and they're just like, they're stuck.
Yeah, I think the dynamic that there might be I don't think humor is the right word in this, but it's interesting because we'll get asked, or we'll get into these conversations with patients, and they'll tell us that nothing's helped, and it's very frustrating and hopeless, and it's discouraging. But on the flip side, the question is sort of challenging, and I think you answered it yourself. But the question is almost immediately after asked, well, can you just point me to someone in my area? And we almost have to point people back to the story they just told us. And it's like, well, what you know the problems, you've experienced them. And so we feel the problems from our end as providers. And so I have a couple thoughts as far as hope and encouragement. One, in the profession of physical therapy, pelvic health, pelvic floor physical therapy, 10 years ago was either like just on the fringe, like it was becoming a thing, and now it's like fairly prominent. And culturally, like providers are referring to pelvic floor therapists, and PTs are learning to specialize in that. And so over time, if we continue this work and get the word out, you guys help us get the word out, this will become more of a thing. We've already trained several physical therapists that are now equipped to treat people with headaches and migraines. Becca, who used to work here, Dr. Muir, is out on the East Coast. I don't know if she's actively treating, but it will grow and the word will get out. And then physical therapists even listening to this podcast or finding patients like you that come out to see us and then go back to them. So it will continue to grow. And then I also want to encourage you that don't use the lack of results in your own story as evidence of like, okay, this isn't a neck problem, or there's no underlying solution, or I'm stuck taking medication. Because we haven't found that to be the case with like almost anyone. I have yet to send someone to go get medication. And so we use our framework to help even in the most challenging situations. Our framework will work. It's how God designed our bodies. And so it's true and it's real. And if we're working on the neck and we hit barriers, then we look at other things. Look at airway. We look at your sleep quality. We look at systemically what your body's dealing with. And so the framework works. And know that listening to this podcast is a step in the right direction. It's a big step in the right direction. And if you have the ability to implement the things that we talk about, I wouldn't be surprised if you start seeing some relief. I've got a lot of reviews on this podcast where people have told us that they have found relief and they've found something that makes sense and they've started to consider their neck. Even just knowing that your neck could be a problem is a step in the right direction. And so be encouraged by that. When you reach out to us, I mean, of course, don't be like afraid to ask that question, but we might point you back to this podcast because it helps when you understand, step into our reality, and then maybe it encourages you to actually take the step to work with us virtually, because our virtual coaching can be incredibly helpful for people. So you don't have to come out in person. And then, of course, we have the SAM device, which you've heard that little ad halfway through. And I encourage you to purchase and explore that. But thank you all so much for listening to the Headache Doctor podcast. As always, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.